situation to the recovery plan. They're like, hey, look at this awesome plan we have, and the media is going to be like, yeah, right, but the people want to know where the aid is, or so we'll see. 6:38. I want to bring Dr. Peter Lombard on here. He's been studying COVID. He's got some really interesting Facebook posts. And hi, Doc. Good morning.
Good morning.
Hey, good morning. How you guys doing?
There's just so much going on, and I was kind of thinking this weekend that everything you don't want to do wrong in a pandemic emergency response, it kind of seems like the administration is doing wrong twice. And so I was talking with somebody over the weekend, and it kind of seems like on the non-medical, just nothing to do with public health and the response with the testing and all that, and, the actual, what is supposed to be the actual COVID-19 response. There's just been so much nonsense going on with, staffers staying at quarantine hotels, the whole thing with the chief of staff, just, the muting of the media. And so what I think that has led to is nobody has any trust or confidence in a lot of what is coming out of the government of Guam. Mm-hmm. And now I'm feeling that with the latest news this morning that we had 5 recovered, was it 5 or 6?
I think it was 6, yeah.
6 recovered patients now testing positive for coronavirus. I think that people have been kind of, talking about these test results and, there's all negatives. Wow, that's crazy. And now I think with this latest news, it's almost like the last thing that people could have had faith in, which is the science of fighting this virus. It's kind of out the window now because everyone's kind of saying, well, we're saying these people are recovered and now they're testing positive. So how do we even trust the whole process, Doc? So I want to just start by getting your thoughts on that.
Yeah, that's unfortunate. I mean, because I think there's, if you look at other countries, they've been seeing the same thing. So while I think there are reasons and ways that you can explain how this happens that are rational, and we don't know all the information yet why this is happening, but it's certainly not unique to Guam. But your point is well taken. It's going to be harder to have that conversation with people and try to get them to understand that when there's already mistrust. They're gonna think it's for other reasons, that it's everything's being mishandled, the testing's being mishandled. But you are actually seeing that other places as well, and there's probably there could even be a few different reasons why that's the case. And without knowing more details about each case, it's really hard to speculate. But you could say somebody tests positive again, whether or not, if they have, let's say they get symptoms again, they recover, they feel fine, they get some sort of symptoms again that cause them to be tested. We've talked about these dead viral fragments that can live in your respiratory cells, and then your cells get shed over the course of weeks and weeks and weeks. And as you shed those cells, they can be picked up with the swabs. So you might be picking up virus that's inactive virus, and the patient may actually be presenting with an illness or a new virus that has nothing to do with their original infection. So that's one potential explanation for why this is happening. It is possible too that people are reinfecting if they did not mount a strong enough antibody response to the first infection. At their antibody levels, they have some, but not enough. And if they're exposed to it again, or there's some reactivation process in their body where the virus wasn't fully defeated and it comes back, that's also been speculated. But most of the latest studies that I've seen have pointed to, if people are testing positive later, it's due to sort of these inactive viral fragments that you're just kind of shedding over time. But again, that discussion is kind of complex, and I think people are gonna again just question because of the lack of trust that's out there in general.
Yeah.
Mm-hmm. Do you think a lot of the people that have been released on home isolation, that they probably should have gone to the government isolation facility so that they're more monitored?
Not necessarily. I mean, I would say what we don't know is what the public health has been telling these people as they're discharged. If they know this information, if they're following the studies also, they might be telling them, hey, here, just a heads up, this might happen. If you have any symptoms, make sure you get in touch with us. And just to be safe, make sure you're a little extra careful with your own, social isolation practices. And so I don't know, maybe they're telling that to everybody, or hopefully they're certainly doing that now. But yeah,
right.
And it sounds like they have not seen anybody get reinfected either. And that's, or I guess what I should say is the people that are testing positive, they did mention in the report that nobody has been has caught the virus from them on the, sort of their second go, with the infection, if it is indeed another reactivation or another infection in their case.
Mm-hmm. Yeah, and they could be from the same household. We just don't know.
Yeah, and I think that it goes, something that you've been very consistent on in your Facebook posts is calling for transparency, which is nothing new, but the kind of transparency you're talking about is with the testing. Who's getting tested? Not names, but obviously, right? If these recoveries are now popping positive, we want to know what caused them to be tested again.
Yeah. Did they have symptoms? Was it just the patient had a hunch and say, "Hey, I'm just feeling like I'm not completely better."
Right.
What criteria are they using to retest people now that they have expanded testing criteria? Maybe they'll take these folks even if they just have a hunch that something's not quite right. And they're not just for these, but for the 15 or so cases we've had in the last 15 days. Again, what do we know about these folks? Do they have prior contacts with other positive cases, or are they just people coming off the street and we have no idea, where their infection came from? Because that kind of information is, really would be really useful for the public to know in terms of how much wild coronavirus is out there versus related to clusters or pauses that we already know about.
Right, because see what happens is when they put this information out so late at night, I mean, what happens is there's a lot of anxiety out here now, and we're just marinating in it because there's no word from the government. They should have, public health should be calling all the media this morning and saying, hey, we just want to give you more info on that because, people are freaking out, and they're kind of freaking out. And again, just going back to what you've been saying, is this is something that I don't know. Maybe you come out with it the first time.
Yeah. It's really not asking for a lot of information, and it would really reap dividends for public health to build trust. I mean, it'd be one or two extra sentences, in the report, and that's it.
That's it.
And it would build so much trust, and so much more trust. And I think they can easily do it in a way that doesn't violate privacy issues.
Yeah,
I wonder if it's going to be like on the dashboard, public health's dashboard. I didn't see the breakdown, but if the mayors are informed, since they inform them how many are recovered, I wonder if there's an indication that says, retested positive. You know what I mean? So you're going to have to look on there.
To the site. Yeah.
I wanted to ask you about public health's new direction in terms of going out and expanding their testing. Over the weekend, they were at Hemlani Apartments in Harmon, and it is characterized as a possible, vulnerable population, lack of access to health care. Do you agree with this route that they're taking?
Because
nobody turned up positive from Hemlani.
Yeah, I think it's actually smart to go after, target certain areas. I'll say certain facilities or certain types of lodging. There are studies coming out that are looking at areas where there are more clusters or sort of these what they call super spreader events. And so nursing homes is clearly one of those, or a situation like a nursing home. A lot of people living in an enclosed space, so multi-family, or there's a lot of people in an extended family living in one space. Those are areas to target for sure. And if they weren't doing this and they were just waiting for the patients to come into the clinics and hospitals, again, we don't know. I don't think they've had. I think they've only had one positive come up from the community testing. There's one from Agate, I think. The rest, I think, have been negative across the board. But even one tells you it's out there in the community, and I think that's useful information for the public to know. That we have not starved the virus out of the community, which I think some people were probably thinking that's what we've done when we had a lot of zeros. And if you went
around this weekend, you saw that it's not just some people. A lot of people are thinking, oh, we're talking recovery already. The zero pod is they're just kind of out there, buying barbecue stuff at the store. They're going to the beach. No one is taking it serious.
Well, even though it's still out there, I think that's also to be expected. And this is what we have to live with for months now. It's cases popping up, isolate them, test them, isolate them, trace their contacts, and repeat over and over and over again. And what level of how many pauses are we willing to accept before we elevate the restrictions again? And I think if the past few weeks are an indication, in the past few weeks we've seen us go from a certain state of shelter in place to roadblocks, to taking the roadblocks away, and the numbers have been pretty consistent. despite increased testing. So I think that's an indication that probably things, if anything, they might trickle up a little bit. Again, if the past few weeks we got 15 new cases, 15 cases in 3 weeks, isn't that bad? And one hospitalization, maybe our healthcare system can easily handle that. Maybe we can handle it 2 or 3 times that. People will probably go crazy if they say 3 times that. You start getting 15 patients a week, 2 to 3 patients a day showing positive, and then people really might get a little bit more worried.
Right, but I think what's interesting is in the recovery plan they allow for so many new cases, to have so many new cases and still move forward with the recovery plan and then kind of adjust it in terms. So I'm wondering what the threshold is. I know you kind of dove into that.
Yeah, I think Dr. Clare answered a question about that. He seemed like they were going to take a very rational approach to this. I mean, the way that it's written actually, it says within a 2-week period you've got to show a downward trend. And if you actually look at the metrics that they were talking about right now, it actually shows a slight upward trend. But I hope that they just take a rational approach. I mean, you have 0s and 1s and 2s on our daily count. You go from 0 to 2, and you're going to have an upward trend, but that doesn't mean that you're in bad shape necessarily. Right, yeah. So I hope that they just take a rational approach to their decisions about moving within those PCOR levels. And what the threshold is.
Hey, everybody, we're in PCOR 1. I just throw that out there. I forgot to say that.
What do you think about that 5 cases threshold?
I think that's reasonable. I mean, if it was 5 per day for a week straight, that would be a little challenging, or a little bit worrisome. Okay, my daughter's gonna. I'm sorry.
It's okay.
Yeah, no, I think if we were seeing 5 new cases a day for 5 days in a row, that would be a cause for alarm. That would not be normal.
Right.
That would indicate that there's some a big cluster or 2 or 3 out there that we need to worry about.
So just based on the information that we are receiving, do you think, and the 4 triggers it appears that we might be meeting, do you think that we're ready to reopen on May 9th? I think that's Saturday.
Yeah,
gradually reopen.
I've alluded to this in my blog. I think we're ready. I mean, I think the triggers, again, if you're just rational about the first trigger with the number of cases that we have, I think we're ready. I mean, but people have to do the right thing in the workplace and out in the public. They have to wear their masks. They have to social distance, and I think it's entirely possible that we don't see a huge change in the number of cases that we're picking up every day.
Okay.
Doc, I wanted to get your 2 cents on I'll just go back to this press conference Thursday because I saw you had posted about it. What was your take on the muting of the media and how that was handled?
Well, I don't know how much they could have predicted that's what would have happened, but I think if you ask the media not to ask a question, that's the surest way to get asked a question, and to be shocked by that happening. I mean, I can see your position. You want to do what's right for the media and censorship, and so you don't have anything to lose by asking the question. It's you either get the answer you want, or they'll shut you down, and then it potentially makes them look bad. So I think from the way it played out, I think probably could have been predicted by them trying to tell you what questions you can and can't ask. So I think it's unfortunate, and if they didn't want to be asked certain questions, they needed to address the issues in advance in some fashion,
Right,
and even then they have to be willing to address those things.
Mm-hmm.
Yeah, and I think to be fair, it was a little more complicated than them telling us not to ask a question. We're like, oh no, we're going to ask it. We go in, we have a plan. We go in, we have our questions, and when they came out and said we're only going to be taking questions about the recovery plan, I mean, we have 2 reporters going in there. So Nestor, of course, is covering the recovery plan. And we just made a call. We're going to stick with the questions we're going to ask. I mean, that's our job. I don't know where the government gets off telling the media what they can and can't ask about. It's just kind of crazy. And then, to me, what was even crazier was you were an elected governor. We had a sitting lieutenant governor right there. Who's the boss? Is it Janela Carrera or is it the governor? I mean, the governor could have simply raised her hand and be like, no, Nan, it's okay because the people keep asking.
Yeah.
Instead of just sitting there and there was something like she waved her hand like, God, what is their problem? It was just, all kinds of bad, I don't know who is advising over there, and I don't know if like that was all Tony Babauta's call, and that's why he's not there anymore. But what they're lacking is someone in the room to be like, "Hey, mute the," because I could just see it in my head. I could just see Governor Lou saying, "I don't want to go to the press conference because they're just going to ask me about Tony Babauta," and then I don't know who in the room said, "Oh, don't worry, Governor. We'll just tell them they can't ask about that." Oh, okay, that's problem solved.
Yeah, exactly.
Problem solved.
It'd be so interesting to know how they come to these decisions. And, yeah, the damage control was less than ideal for sure.
Oh, God. I mean, the damage control was duck their head in a hole for 4 days.
And they've got a lot more damage control to do moving forward here, and they still have a lot of tough questions to answer while they're trying to get information out. And that's, I think the plan was pretty good overall, but that message and the whatever triumphs they could have pulled off in terms of their public relations was just drowned out completely by this other issue.
Right. Way to rain on your own parade.
Yeah.
I wanted to ask about something else, though, and this was just in reference to the letter that was signed by the governor and Linda and Pinko Denorsi, allegedly. And what are your thoughts on having a hotel as a quarantine and an isolation facility?
And a staff housing. Don't forget a staff housing.
I'm just wondering, because I thought that they had a government isolation facility being Days Inn, but then when I read this letter, it was PacStar was a quarantine/isolation facility. So it sounds like they're having people who are in quarantine with people who have tested positive for COVID.
I guess, was that something really early in the course of all this?
Oh, no, it's basically based off a letter that was written to Pacific Star from the governor and public health director Linda Denorsi, and it was basically telling Pacific Star, "Thank you so much for letting us use your hotel for a quarantine/isolation facility." And then in asking about which staffers are being afforded rooms at the hotel, the info had come out that it was Rebecca Respicio, Alice Tyron, who are, I guess, working the quarantine facility at PacStar, and then the deputy at the airport, John Kanata. And we said, okay, so John Kanata, is he working the quarantine too? And they said, no, we can't respond to why he's there because of HIPAA. And so, I mean, you could kind of put two and two together and figure out what they mean,
And I just wondered your thoughts on mixing quarantine and isolation patients.
Well, I suppose it all depends on how they go about it. I think it probably can be done within the same facility in a way that makes sense. And, maybe they were doing it because they weren't sure that the people on the receiving end had a clear idea what the difference was, and they just wanted to group them together or something like that.
In Saipan, they have one hotel for travelers, inbound travelers, and then another for PUIs and cases. But then Saipan also released how they're spending the CARES Act money, so I don't know.
Yeah, but at Days Inn, at the isolation facility, they have nurses, staff with people. So I'm just wondering if that would be the same over at PacStar. You'd have nurses on standby.
Well, we got Dr. Ho on the line, so maybe he can answer for us and we'll ask him. Hey, thank you, Dr. Lombard. I definitely appreciate your insight.
Okay, Bree, Chris, thank you. Take care.
Of course, yeah. And wash your hands. Are we still washing our hands? Are we still washing our hands? We are, right?
Yes.
Okay. I'm just saying because, Okay, Doc.
All right, take care, guys.
Okay, bye.
I dig Dr. Lombard. Every time I call him, he's like, why would you want me on? I'm just a little Facebook nerd. Let's get Dr. Hoa, Dr. Wen of the American Medical Center Family Clinics. Dr. Hoa, good morning. Happy Monday.
Good morning.
Good morning, guys. Morning.
Well, you're just walking into the bomb blast this morning, but I know you never shy away from the fallout.
It's okay. What's up?
So I guess first question: how do we handle the news that there are 6 patients who